So, good afternoon, everybody. So, welcome you all for this Friday free webinar. So, today's theme is on inspiration and insights from nursing leaders. I hope you all can see like who is our special speaker today. So, before getting into the session, for the benefit of the newcomers, I would like to take you all through the quick introduction about us. So we have been established since the year 2018, and we have been committed to providing comprehensive training programs to enhance the capabilities of the healthcare professionals. And for now, 10,000 plus healthcare professionals have got benefit out of our programs, and 75 plus hospitals have networked with us. And for now, we have launched 50 plus course topics. And It's no 10,000 plus nursing professionals who have added in our community. It's not the end. So today also we would have been having a newcomers who are attending to our webinar program. I request all to join our Skills4Med community to enhance your skills and build your confidence and make magic and transform your patient care. And I would like to take you quickly about what is actually the Skills4Med logo speaks about. So we have 4 stages. The stage 1 speaks about the service excellence skills. For one healthcare professional to survive in the healthcare industry should have a basic qualities that is about the infection prevention basics, for example, communication, and also about the professionalism, etiquette, all is about is in one package in service excellence skills. So once you have got into this program, you are can look forward for the stage 2 training. It is purely about the core patient care skills. So that is actually for the, it's entirely about the bedside procedural skills. So you would have heard a term called competent. So competent in one procedural aspect, and competent in one process. It's not about that. So it's about core patient care skills where we are trying to transform yourself as a clinical expert. It is competent in all aspects of procedures. So once you have become a clinical expert, it is time to look forward for the stage 3 training, which is about the specialization skills. So you can either select your specialty, or already you're in a specialty. For example, you're in a labor room upskilling program, ER upskilling program, and a clinical instructor program for the nurses who have been stagnated in the same position, have to have a career transition as a trainer, and also infection control nurse course program in the stage 3. So once you have become a clinical expert and a specialized nurse, it's time to look forward for your leadership pathway. So I would like to show you, you have a 2 pathway when it comes to nursing. One is vertical pathway, that is starting a career as a staff nurse, then senior staff nurse, in charge, supervisor, ANS, DNS, and the CNO of the hospital. Today, I am so happy to announce this because we have a real role model for the lateral growth. So, this is vertical path. Another path is about the lateral growth, that is seeing yourself in the operations department. As a nurse, you have all the, skills to resolve the patient problems, where you yourself can look into the operational skills, transform, take the lateral path, and become a CEO of the hospital. So that is all about. So this is the 4 stages of the Skills4Med learning pyramid. And I have an announcement, that is infection control nurse course program, which is collaboratively given by Skills4Med and 𝐲𝐬𝐲. This is a special offer running. The price is on the display, and the course highlights a comprehensive, where we have seen many nurses who have transformed themselves as an infection control nurse from the bedside after completing this program. And to know more details about our course, you can contact Ms. Jayanti. The number is on display. She is our admin manager. And also you can visit our website, which is www.skillsformed.com. So here is our real role model for the lateral growth of stage 4, what I was talking about. So I'm so glad we are truly privileged from Skills4Med to welcome you, Mrs. Grace Mathai, an exceptional healthcare leader and a role model in the nursing and hospital management community. She is the Group Chief of Quality and Governance at Baby Memorial Hospitals, Kerala, and in her immediate past role, she served as a CEO of Baby Memorial Hospital, Calicut. Over the course of her her career, she has held diverse senior positions, including group quality consultant and Chief Operating Officer, Hospital Administrator, and Nursing Director in leading hospital across Mumbai and Kerala. Mrs. Mathai holds a strong academic background. She is graduate in nursing, completed her master's in hospital administration from TIS Mumbai, pursued MHRDM from Mumbai University, and also holds a postgraduate diploma in medical law and ethics from NLSIU, Bangalore. She is a certified green belt in Six Sigma, a lead auditor for ISO, and has played a pivotal role in healthcare accreditation in India with NABH. She has contributed as a principal assessor, faculty for assessors course, and serves as a member of both technical committee and the accreditation committee for the 2 terms each. She has personally assessed more than 200 hospitals across the country. Currently, she serves as a co-chair of the NABH Accreditation Committee and chair of KAHO, Kerala State. Her contributions to healthcare quality were nationally recognized when she received the FICCI Award for Excellence in Healthcare Leadership in the year 2023. Please join me in giving a very warm welcome to Mrs. Grace Mathai, Madam, whose leadership, dedication, and lifelong to quality healthcare continues to inspire professionals across India. And I am the one of the fan follower of you, ma'am. Welcome you, ma'am.
Thank you.
Yes.
An elaborate introduction.
Thank you so much for giving me this opportunity to introduce. So I am so happy to introduce you here in this forum, ma'am. So the next comes, our Parivalavan, our Dr. Parivalavan Rajavelu. He is a highly respected consultant surgeon, and he is the backbone and visionary founder of SkillsforMed. He is a passionate advocate for the healthcare quality, and he plays a key role in KAHO. He contributes as a mentor, national speaker, and GC committee member, and he serves as a chair of EndoSafe, actively promoting endoscopy safety across India. His leadership deeply rooted in extensive clinical experience, ongoing research, and international presentation. Through SkillsforMed, he continues to advance the healthcare outcome by equipping the healthcare professionals and skills and by applying the practical knowledge. Dr. Parivalavan's unique blend of clinical skill, academic rigor, and system level of thinking makes him an inspiration and change maker in today's healthcare landscape. Please join me in welcoming our Dr. Parivalavan Rajavelu. Welcome you.
Thank you so much, Stella. Thank you so much.
Yes. So we are all like, it's unlike other webinars. Today it's going to be a live podcast webinar. We are going to watch out. So I am equally excited to looking forward to it, sir.
Thank you.
So I'll stop sharing here.
Yeah, please. Do you want to just tell about the activity-based nursing or later?
Can I?
Yeah, I can say that now.
Yeah.
Madam, we're just going to have a competition. Just 2 minutes.
Yes.
On that. If you don't mind, madam.
Oh, yes, no problem.
Is my screen is full?
Yeah, it's showing the introduction slide.
Yes. So this is the, last week we had a competition on how many SkillsforMed webinar certificate you have, and we had a valid time to see you all, like how much interest you have shown towards our webinar. So same like we thought of, on October 17th, we have a webinar topic on activity-based nursing. So we thought of running a contest for that. So that, you'll be like the program, the contest name is like activity-based nursing implementation championship 2025. So I'll give a quick announcement what all we are going to have there. So on 29th September, so today you will be getting the registration forms both in NPower group, and also Jay, I think you're putting up the registration form in the chat box now. So during this announcement, the registration forms are already there in the chat box. You can fill the form or you can copy and paste the link, keep it saved. So you have a deadline to submit the registration form on or before 29 September. So once the registration form have been submitted, to the interested participants, we'll be sharing the project proposal form. That is a Google form, which you have to fill in your details about your project, and we'll have a template inside the Google form where it will be helpful for you to fill the form about your, how you're doing the activity-based nursing allocation in your organization. So on 5th October, that's the deadline for the project form submission. Okay, and once it is submitted, we have the distinguished people, nursing directors and the nursing heads across, in our known circle. So who will validate your project form, and from that we'll be selecting top 3 contestants, and it will be announced on 8th of October. And on 9th of October, so you will be shared the presentation template where you have to put all your project and your details related to the activity based nursing allocation. We'll be providing a template. You have to provide the details in there. So that top 3 contestants will be given opportunity to present on 17th October 2025. So this is all about. Again, I'll be sharing this instruction details in Empower group, and also you have got the registration form in your chat box. You can start filling up, and also do not worry, we'll share the registration form when we are giving out your certificates after this webinar completes. Thank you so much. So I'm stop sharing here, sir.
Please don't start filling the registration form and miss what Gracie ma'am is going to say.
Yes, absolutely. Not now. Copy and paste and keep it aside. You have time to fill that form.
See, the reason we are starting this is, a lot of us, because I think ma'am also will agree. When we go around visiting hospitals, we find this is one aspect where a lot of hospitals are struggling, how to implement equity based. So we thought, we can get a collective input of many people may be doing it, much better than what we know. So this is an opportunity for you to showcase how you're doing it, and we'll select the best 3 of the implementation, and we'll also help you to actually publish this. We can give you assistance to publish it so that it comes in journals. Okay, so with that, we'll get back to our conversation. So can you just stop sharing? Ma'am, thank you so much for coming. I mean, so happy to have this. We have been talking about this for a long time, but for several reasons, you've been so busy. You've been traveling so much. So finally, I was so happy when you said yes, and here we are, having this conversation. Thank you so much, ma'am. So
From my side also, thank you so much for inviting me and giving me this privilege.
Thank you, ma'am. So I want to start from the very beginning. I want you to take us to your early days, right from your childhood, and what initially drew you to nursing. When you were young, was healthcare even in your radar, or it was something which came later? No, we would really like to know about that.
Actually, I belong to a joint family at the earlier stage, where entire family were staying together. And then it was a very pleasant childhood days because there were very less female members in the family, and almost everybody was male. Only we two were there in the female members. So we have been pampered too much. Though we were not that rich, but we were only medium level people. But the pampering was too much for us. So, but as you asked me for the earlier days, I just would like to give you one example. In my early studies, my 4th standard teacher, she has really influenced me for doing certain, truthfulness, honesty, integrity. Those things have been apart from my parents, particularly my father. The teacher who has influenced me from the beginning. So now also I remember whenever I go to my native place, though nowadays she's not there, nowadays means she's no more. But still when I pass through her house, I'll just stop for a minute and look at there thinking that she's watching there or she's standing over there. That respect I give to her that. Coming to nursing, Dr. Pari, was never a choice. My uncle wanted to take me to Jamshedpur, Tata Steel. He was working as an engineer and he wanted to take me also over there. Everything has been planned. The box is being tied, and tomorrow I am leaving to Jamshedpur. And today night, my uncle is telling, he was unmarried at that time. He's only 5 years elder to me. Then he's telling last minute in the family that how can I take her? Because where I keep her, I am staying with bachelors, so where I'll keep her. And my father's elder brother, who was the head of the family at that particular time, if I can say, he blasted on him. He said, everything is ready. The girl have gone and told in those days we used to go to our father's relative, mother's relative, and we tell them I am going on one side. So big gathering of relatives at my house, and our house itself is with so many people and a big gathering, and they all came to leave me. And now this uncle is telling that he cannot take. So father's uncle got very, very angry, and then he said, I will not unpack this box. That was hidden there. And really, he did not unpack. What happened from there only? That time there was no mobile phone. So he went out and then he phoned one of my cousin, Andy, who was at Agra. She was the nursing superintendent at that particular time. And then otherwise they never wanted to send me to nursing. So they said that I want to now send her nursing. This is the reason. Somehow you have to accommodate her. And then next day, my Bade Papa means my father's elder brother, and my husband, my father and my mother, they don't know what to say. It is his decision. And then he took me from Chenganur, where was my original place, to Ernakulam, because there was no train from Chenganur to Ernakulam at those days, and there was no flight. So he brought me to Ernakulam, and we stayed in one of the relatives' house. And the next day, he put me to the train. And you can imagine the age of 70 and don't know anything, never went out of house. And then he introduced me to one of the passenger who was going to military, that she's first time going. You have to drop her in Agra and someone will come and pick her in Agra. So you can imagine 3-day journey. I came down to Agra, and then there, that particular time for UP state, the interview was going on. And I got posting at the MLN hospital, Allahabad, because there at one place interview will be there and they'll be posting the people at different places. So I got at MLN hospital, Allahabad. That is what my early nursing.
That is a fantastic story. I mean, I think the forces above destined you to become a nurse, and I think they all. This is. I mean, several times I've seen it in my own life. We would want to do something, but then something moves up, and the strings get pulled in a different direction, and we have a different destiny. But I think I'm so glad that happened, because now we have such a fantastic leader amongst us. So it's a really very, very interesting story, and thank you for sharing that. But I just want to, before getting into nursing, I just wanted to I was looking at your CV, and all along you've never been satisfied with your degrees. You went on getting more and more qualifications, like your hospital administration at Tata Institute of Social Sciences in Mumbai, then HR management and law and ethics. So was this continuous learning part of your plan, or did it keep evolving as you went on?
No, Dr. Pari, definitely it was not my plan in the earlier days. I just came for nursing to go abroad, let me tell you, because once I came to nursing, then my mother's people are at USA as well as in Singapore. And then they told my mother, good that you send her to nursing and then we can take her over there. So later part, that was the only thing. But fortunately, I got married as soon as I have completed my nursing, and I got married. And though I got opportunity at different places, my husband said, no, I have not married to send you abroad and get money. I married you when I feel the need of a wife. So then I did not go anywhere. Then what I thought, then in this case, then I should go for further studies. So I was just a general nurse at the initial stage, literally frankly. And one day, then there was some incident. Time will not be there, so I don't want to give big incident. But what has happened, after my second child birth, I got typhoid, and then I was sick for some 21 days. And then when I went back 21 days, that my head nurse at that particular time, oh, you have rested for 21 days. Now I'm going to put you to night duty. Then I requested her, I said, please don't put, because I'm feeling so tired. I was really so tired. And then as I'm feeling so tired and typhoid with so much complication. But she didn't agree. She said, okay, no, you have to do night duty. Anyway, I have to do, I cannot say no. So I did night duty. It was a 1 week night duty. On the 5th day of that night, early morning, after giving what I mean to say form, and it was a polio ward where 135 patients were in the government hospital. And then we have to give fomentation to all the children. So we two were there for this 134. One was my senior and I'm junior, and my senior did all other work. She asked me to do the fomentation of all these children. So in one particular room, we have fomentation facility where the mothers bring the children and then we do the fomentations. And I finished, but I was damn tired. Then I told her, and early morning we used to get tea. Then she told me, Gracie, you are so tired. You please go and have your tea. Maybe at 6:30 or something like that. Duty is only up to 7 o'clock. So she said, you go and have it. I said, no, I just want to sit. Please, you go and have your tea. She went from this side, and by the time our MO came in, and then she found me sleeping within that a nap of that second. Well, I just sat in my chair, and then I don't know that nap, what I can say. And then she catch hold of me, and then she said, oh, this thing, and then a memo is being issued. Then my husband said, no more going to nursing, you sit at home. I don't want you to work also. Then I said, no, I will not sit at home. Then he brought this further higher studies details, and then I went for diploma in nursing education at Delhi. Then I went for post-basic BSc nursing, that is at Bombay itself, Maharashtra itself, from 𝐍𝐮𝐫𝐬𝐢𝐧𝐠 School of Hospital. Fortunately, what has happened, I was staff nurse. From there, I have been promoted as a tutor, then as the principal tutor. Then later part, there is a nursing superintendent post. By seniority, even at that particular time, I got that nursing superintendent post. Then I thought of, no, I should not sit into nursing superintendent. There I thought of doing some additional thing. Not only these long certificates, I have done n number. You can tell me more than 100 numbers of short courses of 1 day duration, 1 week duration, 1 month duration, all on skill development, personality development mainly, not on the nursing or another. This is what I have done. And then I thought of going into this 2 years master degree in MHA as well as that was in the full time, and then MHRDM from Mumbai University, that was part time from evening 6 to 8. So these both I have completed at that particular time. And then now when I came back over here, when I say in Kerala, and I am just working, and when I have been appointed as a CEO, what I thought, no, I should know something of law also. And the best school where I joined is the best school in the country. So I have joined that law also, and then I completed that also. It was never thought, my thinking in the initial stage, but what I can tell, maybe it came on way.
All right. I think there are two very important lessons, I would want to unpack here. So one, in the face of adversity, madam, took up to education and improving herself. That is number one. And then the unending thirst, which lasts even after, if people reach a CEO post, they'll just relax. Okay, I know I've come to the pinnacle of my career and people will relax. But here is someone who, wanted to be more qualified for the post even after getting it. I think these are such important lessons, madam, from your life. I think we need to, really, take it up as an example. So I'm going to just, go into your, leadership roles. And you said, you were becoming nursing superintendent. So we'll start from there. So from bedside to getting into an admin, I think can always be challenging. So when did you first realize that, that you were actually a leader and you had some responsibilities?
Dr. Pari, my leadership, I can tell you, it started from my student life itself. It's not at becoming staff, because during the student life, I was the SNA president for the unit, then for the state SNA president. So when the national SNA conference was happening at Delhi, even I was on the stage, sharing the stage with Madam Indira Gandhi. So that from that level onwards, I am that. Okay, no, I can go a little behind also. When I was in the 8th standard, there was a debate, science of art, which is best, and I have participated in that also. So my leadership as such, I might have received from my father. So that I carry forward. That's one important thing. When it comes to, and moreover, I am a bedside nurse. If I miss this, whatever I say, if I miss this, my career is not complete. See, when I was a student nurse, the patients from the roadside, because it was a government hospital, roadside patient, which too much of maggots and all those things have been brought to our hospital. And, roadside, you can imagine how they will be. I used to take them to the toilet and giving them a proper bath in the washroom and then putting all my attires and all those things. And then when they come out, they used to tell me like this. They may not, they don't know what to talk, but they were just blessing me like that. And that blessing I got from treating those people. And in another occasion, I want to mention that in my midwifery place where what has happened, 20 tables were there and all 20 were full always. And I was conducting delivery in one corner, and I found in the another corner already the head has descended. So leaving this, I ran to that place and I conducted the delivery. Otherwise, the child would have fallen on the bucket, because one bucket we used to keep. Now that parent was of a VDRL positive, and you can imagine the lochia of the VDRL positive, how it smells. And I don't know, for 1 week after washing, how many times my hand, the smell could not go. And even my friends used to feed me with the spoon, because that much difficulty I had. But to tell you, I was a real bedside nurse, and I got reward and award for that also. Coming into after this qualification, when I said that immediately, maybe because many people refused to go to suburb to work when the School of Nursing started, but I opted for that. So I become the senior among all other senior people. So I become the nursing tutor, then become the principal. That time there was no principal, they were known as senior tutor. So, but doing the work of a principal tutor. So I become the senior tutor. And then what will happen? And then immediately there was a nursing superintendent post came, and that also came to me automatically. Actually, I am little assertive, and I had little infight with my medical superintendent at that time on some ethical manner. And then when this post of nursing superintendent came to me, I just went to the medical superintendent. I said, "Madam, you know my nature. I speak on ethical panels. So you may not like me. So if you don't like me, tell me. I'm happy in my teacher's post." He said, "No." She just embraced me, and she said, "No, I want people like you. Though we'll have little here and there, little difference of opinion, but I want people like you to take up." And that in a Maharashtra, where every Maharashtrian girls will look into Maharashtrian people, where I, a Malayali, become the first time a Malayali become the nursing superintendent. To tell you, Dr. Pari, it is my surprise. People started talking that now our matron has come. Till now, it was not our person. Maharashtrian was there, and they are telling till now she was not ours. Now this Malayali have come, and then she is now ours. That way they have considered me, because maybe in my teaching time and all, I might have helped them for their various few personal things or something like that. So that nursing superintendent post came over there. Then it was with Bombay Municipal Corporation, with all luxury, no problem like. And that time, Lilavati Hospital, there was a nursing director's post. They came to me, and again from here onwards, I have not applied for any post. Every post came to my side. So this Lilavati Hospital came to me at my municipal hospital. They said, "Can you come and help us in establishing the hospital?" Because it was one of the first initial private hospitals at that particular time in Bombay. So I went over there, and I worked as a nursing director for 5 years. And ultimately, I have to shift to Kerala, because my father-in-law was sick, and then he wanted us to be in Kerala during his last days. And then me and my husband, we moved to Kerala. Unfortunately, I lost my father-in-law within 3 months of arrival over here, and where I'm happy that my husband and he could take care of him. And then this, when I was coming, before I was leaving, the MIMS people came over there and they spoke to me. I don't know how how they came over there, and they spoke to me, and I have joined over here in Calicut MIMS at that particular time. Today it is Aster MIMS, and earlier it was Calicut MIMS. I joined as a nursing director. From there, they have promoted me, that I have not done anything. Automatically, the chairman, I will never forget the chairman, Dr. Asad Mupen. One day he called me and said, "You are going to be the hospital administrator." First question I asked, I said, "Sir, if you made me hospital administrator, you tell me how the doctors and other categories will agree with me. I know the nurses will agree with me, because my nursing relationship was very good, and I know my nurses will accept me. But what about other categories of the people?" And I said, "Sir, it will be better you take the concurrent of them, have a interview with them, and ask them that whether they like me." He said, I have done all those in the past and they want you. And that's why I'm giving you this post. So that hospital administrator, then head administration and HR department, I got from there only promotion. Then Kottakkal hospital, when it has come, they promote me to chief operating officer. From the Kottakkal, then my husband got a stroke and then I have to shift to Ernakulam. So I was almost at the verge of leaving MIMS, but that particular time, Astra Medcity at now, which is at Ernakulam, that initial construction of that Astra Medcity have come. Then he put me over there as looking into all the construction. My designation was administrative head, but I was looking into the construction and signing all the check. You remember 500 crore check I was signing, and I was so afraid that I don't know what I am signing because I am not aware. These people come and took my signature. Anyway, second signature was also there. And so I was in Astra Medcity up to 2016 when the hospital officially inaugurated and they put me to the quality head of the entire group in the Kerala, India. India, we had some, at that particular time, we had some 12 hospitals. So I became the quality head of all those.
Yeah,
and 2016, I left.
Madam, about when you were in Mumbai, I mean, I know it would have been a totally different experience. So how, I also wanted to touch upon, I know that, in MIMS, people were, wanting you to become the leader. But how was it in Mumbai? Did they accept you or was there any resistance?
Oh, there was no resistance. Now, actually, if you go to Mumbai, even now also, Mumbai is a place where every culture of people are there. And acceptance, and I was in Mumbai from so many years, like, not only me, there are n number of Malayalis are there. So acceptance, I was never, and moreover, people always talk that Malayalis, wherever they go, they work. They comparing to other categories of staff, no, they work hard. So people prefer Malayali nurses. Even when I was a nursing superintendent, nursing director, my doctors will come and tell me they don't want Maharashtrian or Gujarati nurse, so they want Malayali nurse for their department. Because maybe Malayalis don't work in Kerala, but when they go there, they may work more. I didn't face any problem.
Yeah, I think one, amazing sort of nature you have, which I actually noticed when I was sitting in your room when I came there, to Baby Memorial Hospital. You were talking to me, and then suddenly, your secretary came and told there is a doctor, who wants to meet you. Immediately, you rushed outside to meet the doctor. And actually, when you came back, you apologized and said, sorry to make you wait, but I don't want to make this senior doctor to wait. I'm very sensitive about it. So
yes, Dr. Pari, it is in my blood, even now today.
Sensitivity to others has really touched me at that moment.
It's because I don't want anyone to wait, because they leave the patient in the OPD and come to see me. Rather, always I go their place. I don't invite them. But sometimes what happens, they themselves will come. And then whatever I am doing, I'll get up and I'll give my ears to them and I listen to them. Then I send them, then only I continue my work. That is my maybe my way of working. And that's why maybe when I have come to Baby Memorial Hospital, I came Baby Memorial Hospital as a quality head. And then and I told them that I'll be there only for 1 year or maximum for 2 years, because I have already reached my retirement age. Rather than sending me back, my chairman told me that, no, I'm going to make you as a CEO of the organization. There, so I asked the same question. I said, sir, you ask your doctors, you ask your other people, are they willing? They said, no, within these 2 years, they are happy with you. And they all are happy that you to be the CEO of the organization. And during this, my 8 years of CEO of the organization, I can tell you, it was a fulfilling experience. I don't want to waste time. It was a total fulfilling experience where entire my senior faculty or middle level staff or even junior level staff, everybody is satisfied. Even today also, because I'm here only, when I go here and there, I know the respect what I receive from each one of them. That's what great they speak about that.
It's, I think, your humility which really makes people endear, to you, I think. I want to touch upon another very important. So far, we are talking about your leadership, but I think you have transformed, the quality landscape in India. So I want to touch about that. And you've been, instrumental in or being a part of NABH right from its inception in 2005. So how, with all this administrative thing, what drove you? How did this passion for quality an accreditation come, madam?
Dr. Pari, this came when I was working with the MIMS hospital, the 2005, that particular time when initially the NABH when it is formed. And that particular year itself, that I thought my passion towards that has been increased. I recognized it can be a transformational framework in my life. That's what I felt. And I also felt that the healthcare delivery in India is highly variable across institutions, because you can say in the tier 2 cities, tier 3 cities, the healthcare is not that what we wanted. Where maybe metro cities, that healthcare was available over there. So while there were centers of excellence, there was even lack of uniform standard, process, accountability, which directly impact patient safety and trust. That you also will agree with me that was happening in that particular time. So I joined, rather what I can say that MIMS have deputed me for NABH assessor course, and this NABH embedded evidence-based practice, you look into measurable outcome and okay, culture of safety or a continuous improvement, whatever you call, and that is being seen in the healthcare hospital. I also felt that it is my personal responsibility also to contribute not only on a what do you mean say as a healthcare professional, even to someone that who understand the challenges of implementation in the ground level. What kept me motivated was seeing the change accreditation could bring in the country. As such, to tell you, it brought a structural changes, dramatic structural changes with so much of other things. That is what routinely, if you have seen after the accreditation. So I was too much passion to be in the accreditation part.
Yeah, and I also want to point out, I think Stella maybe missed out in the introduction, that you led MIMS Kozhikode to become the first NABH accredited hospital in the country. I mean, that is an amazing achievement. I mean, just imagine you are the first person leading it to become a first hospital in India to become NABH accredited. So tell us about that experience and how did you convince the people who had no idea of quality to come into this journey?
Dr. Pari, it's a story. It's a story itself. See, at that particular time, we had only the standard. There was no guidebook. There was no consultant. There was no POI. There was no training. What we had in our hand is the only standard. Now, what happened? I had one mentor, Dr. Verma, and then me. Each one of us will read one objective element. We interpret the objective element our way. And then, okay, we are happy. Next day, sir will say, Gracie, I think the interpretation is something different. And then he will bring something and then we adopt that. Next day, I will do something. So all those 265 objective element at that particular time, we have interpreted by our own way. Because I have interpreted at that particular time, I have to go through every objective element minutely and to see that what is and what is there. Because of that, what happened? Even I know every word of the NABH, that standard book. Maybe the 6th edition I may not be knowing, but those particular first and second edition later, because we have gone through everything. So it was really a great opportunity. Now, there were great resistance from the staff as well as from the clinicians. Why there was resistance? Because people don't want to adopt new things. Particularly clinicians started questioning why this documentation, why that have to be there and this have to be there. Already our hospital is running smoothly, everything is happening properly, we have sufficient patient, so why we should go for some additional thing? All these type of things were there. But what was my role at that particular time to tell you, to bridge the gap, to make everyone understand that accreditation wasn't about paperwork, it was about embedding quality into our daily practice so that patient safety become non-negotiable. This was only I was emphasizing. And over time, there was resistance. How I have overcome this resistance? By constant dialogue, by constant training, and by celebrating small wins. Celebrating small wins, I can say, if our HIC result come little less, I mean, infection the statistic is less, oh, we celebrate. When I found that medication rate is reduced, oh, we celebrate. And then when I found that, oh, this process, admission process was a little complicated, after the appropriate preparation of all these things, I found that admission process is so easy, so we celebrate. All those small things we started celebrating. So when we started celebrating, people have seen the improvement and people have seen the outcome. Even people have seen the patient outcome also. So because of that, I think I could do at that particular time. And especially to tell you, when NABH finally granted us the first accreditation, it wasn't just a certificate for us. It was a moment of pride for the entire team and a signal to the country that Indian hospital could meet even global quality benchmark. That's what I'm just looking into.
Exactly.
Really looking back, I see it as a turning point, not just for MIMS, even but for all the quality improvement activities in our healthcare system.
Yeah, I think that is a major milestone, madam.
Yes, it's a great milestone.
And I also wanted to ask you that having worked in different organizations, I could get these clues of how you had a constant dialogue and how you're celebrating small wins, and now people call it like a framework. Their quality framework. These are all being taught in the quality science, but you did it out of your own experience and intuition. So I just wanted to ask you, because that is the major challenge we are facing, all hospitals. So if you want to make doctors do the hand hygiene before entering, it is not just you can challenge them or anything like that. You need to bring a cultural transformation. So what is your secret in getting to people embrace change?
I never take the credit to myself. That is one of my best thing. Whatever little thing we achieve, I give credit to my community, my team, my staff. And wherever an opportunity is there, I see that that I appreciate them. Whenever a gathering is there, I start appreciating my own people. Then I tell them that whatever we are doing, it is for a poor patient. It's not for me, or it's for not for even the organization. It is a better safety for our patient. That is what I just said. And moreover, I have a good, what I can say, maybe one of my major traits I can say, I am good in communication. And I communicate with the people and I tell them about the ownership. Not only simple communication, and I give them importance of what ownership. Because this ownership will help them that yes, they have done, it is their responsibility, and they will do, and they will have a feeling that yes, it is mine also. So I invest my time in communicating with what I can say, why change is needed, not just what need to change. And then when staff from nurses to senior clinician, when they ask me, then I tell them that our goal is a safer patient, empowered team, and more respectable institution. Then they begin to connect emotionally. That is what, or rather I can say little emotional blackmailing also I used to do it openly. Now I am accepting my thing like that.
No, I think it's such a fantastic approach, because one is, of course, your inclusiveness, and then making people take ownership and recognizing them publicly. I think these are all very, very important lessons we have to learn. I mean, I personally, I started very badly in my leadership journey because I was a very reactive person. But then over the years, I realized that unless you should apologize publicly and also praise them publicly. So that is how
Yes.
learned it the hard way, but I lost a lot of friends before I realized it. But I think naturally you have this what is known as there is one kind of leadership called servant leadership.
Oh, yes, yes. We Christianity, we feel that.
Yeah, you are an embodiment of that. So you have humility. You are of service, but at the same time you are assertive and achieved so many things. So this balance is what is really amazes all of us. And I would want you to give some insight of how do we balance this assertiveness and also humility at the same time.
I keep my balance, if you ask me, by two way. being clear about non-negotiable, such as patient safety, ethical practice, and quality. There is no negotiation. It has to be there. Whereas something related, your team face some problem, that can be, or empathetic looking, those activity can be little negotiable. That's I say. And another thing, being assertive for me, it doesn't mean that authoritarian. I never aggressive. I never think that assertive and aggressiveness is same. Assertiveness is something different and aggressiveness is something different. It means setting clear expectation, holding people accountable, and standing firm on values, uh, particularly some human touch you require for your people, like how you do it through respect, active listening, coaching, and being present for your team whenever they require your help. Uh, in practically, if you ask me, Dr. Pari, I don't always be directive. I'm not there. I involve with them. I rather roll up my sleeves, and when I go for round, also when I see somebody is getting difficult to do something, I just leave my diary somewhere and I started helping them. So I will never stand there by holding my two hands like this and see. So that is what my nature, that could at least, I can say that I could achieve great in my career from beginning from the staff nurse to this level, I can tell you.
I think that's very, very important lesson, madam. But before we get into the next segment, I was very keen to ask this from you because I heard from Dr. Lallu about your visit to CMC,
Yes.
first NABH accreditation, no, Christian Medical College. She was the quality manager, very young quality manager, not the Lallu we see today. And she tells the story of how you went up the terrace in the pediatric building. Can you tell it in your own words?
No.
Every time she tells a story, I get goosebumps.
No. I don't want to, take now Vellore. What is Vellore at that particular time and what was Vellore earlier and what is Vellore now? There is a vast difference.
Yeah.
So that's there. But what has happened? As part of NABH assessment, we have to go and look into every aspect. So there also we happened, and then I was the principal assessor. Then when I asked someone junior, and they actually juniors were all gents were there. I was a lady, but still I climbed there, and then I went up. And then I went up. They said
Just to put it in context, I want to tell the audience, Madam went up to check the water tank of the building, climbing that rusted iron ladder all the way up to see whether the water is clean. Can you imagine that? So this is the commitment which, Madam has, whatever she takes. So that's something which really, has inspired me. Even before I saw you, Madam, I didn't actually meet you. So this is even before I met you, Dr. Lallu. I heard the story from Dr. Lallu and I was so inspired about it. So we'll get into the next segment where I want to talk about your role as a mentor, because in Kaho, that's what I've seen you doing. So, but before we get into that, who are the leaders or mentors who significantly influenced your journey? You told about your school mentors, but along the journey, who are the mentors and how did they actually influence you?
in fact, there were not many mentors, but few were there. My father was my greatest inspiration. Let me tell you very frankly. He was my greatest inspiration. And when I become a nursing student, one teacher from Andhra Pradesh, Mrs. Vetish, she was my next mentor because she has seen the inbuilt qualities of mine, which I have not seen. So she taught that, come on, you know this, you can do. That way she brought me up. And then when I become, what you can say, an employee or a staff, I have two great mentors whom I will never forget. And one is Mrs. Durga Mehta, who is still alive. She is now 94. I met her last 2 months back also. I went and met her. And then another one, Mrs. Abraham, who have told me that particularly in my nature, certain things have to be brought, that she helped me, particularly when you go with the group, you are young. As a teacher, I was only 26 and my students are 18 years older. So there is no much difference. So if I don't wear a sari, she tells me, people think that you are also a student. So she tells me, whenever you go with a students group, you have to wear a sari. Then she tell me, you should not put your, what do you mean to say, your hair loose. It has to be tied up. So certain, and even my, you can see that my, how is my neck of my blouse. All these things have been, she told me. This is the way, because people should look at you. And that particular, at the age of 26, what she told me. So I never forget these two people. They were really, they have influenced me. Great. It is all, even Mrs. Abraham is no more, but Madam Mathai is there. I bow in front of them and I give full credit to them. That's what, even now also, anytime I have a constant WhatsApp message with her, but whenever I get a chance, I will see that, I will go and visit her also. And she also consider me like that. That's what. Otherwise, no other major mentors.
Thank you, madam. I'm sure you would have also faced significant setbacks in your career. Every great leader has setbacks. So can you share a major challenge which you faced and how you overcome that?
That also, these leaders only have taught me regarding the knee-jerk reaction. Because what happened now, anything we hear, immediately we respond. So this Mrs. Abraham told me that anything you hear, don't say, don't defend. If you defend, the other party will think that, no, you are not accepting the fact. So don't defend. Just think, maybe you, for a while, maybe 5 minutes, 10 minutes, then you come forward. That helped me in two situations. One, when I was at Lilavati Hospital, a major incident, Dr. Pari, happened to one of the patients, which is happened because of by one external consultant ophthalmologist. Because of him, that has happened. That ophthalmologist have spread the news that nurses did this, nurses did that, and because of that, this happened. And he went and spoke to the vice chairman. I don't want to say detail publicly, but these things. So vice president called me. He said, Madam Gracy, when he's angry, he called me Madam Gracy. Otherwise, when he is good, he will call me Gracy. So when he called Madam Gracy only, I know that there is something. So Madam Gracy, what has happened? Nurses did this thing, that thing. But Dr. Pari, in our nursing department, there is one good thing is there. Every night, the night supervisor will give us an over at regularly at 6 a.m. Same like the morning supervisor, they will give an over at 8 p.m. So what has happened? We know what is happening throughout the 24 hours. So this information also I already got. So this boss just asked me. Then I said, sir, yes. I was knowing everything what has happened, but I did not tell him. If I tell him, no, sir, it is not the mistake of the nurse, then he will say that I am defending the nurse. So I said, sir, I have heard, I just came, I will go through and I will come back to you. Give me some 1 or 2 hours, I will come back to you. I have already done the investigation, all thing. Then after 2 hours, when I went to him, then he realized, oh, that was the case. So that otherwise, if I would have given a knee-jerk reaction, knowing the fact, that would have affected him. Same like when I came over here in MIMS also, one incident happened like that. And then I just put my resignation. And then I thought, okay, just now I will go and throw this resignation. Then my mind told me, no. You remember the knee-jerk reaction which has been told to you by Mrs. Abraham. Then I put the resignation on my table for 24 hours. Next day, I forgot everything. If I would have, then next day, I went to the person, my boss, in a different mood, in a different way. So it happened. So these two incidents, I will never forget. There are many incidents, but this is what I just would like to say.
Okay, I think that's a very, very important lesson. I think just knee-jerk reaction and letting things simmer for some time really makes a lot of difference, both to your emotions as well as the other person's emotions. I'm so glad that you shared this with them. Now, I know as a woman, especially, you had held several roles in leadership and, being the CEO. So what advice will you give other women and especially nurses who aspire to become, to become like this in senior positions?
I can just tell my nurses that don't let the stereotype define your ceiling. Nurses are natural leaders. They manage crisis, day-to-day crisis in their organization. Rather, I always say from my nursing first starting onwards that nurse can do anybody's work, but no one can do nurse's work. If any other categories of people are on strike, nurse will do their work. Whereas if nurse go on strike, nobody can do. So nurse manage crisis at every situation. And she coordinate team, this is a routine work. And she make a critical decision, particularly when it comes to the patient safety or patient care. And she is an advocate for patient every day. So those are the very skills that translate into executive leadership, let me tell you. So nurses are well aware the working of each clinical and non-clinical in the organization. So when they become a CXO level someone, I can say because they know everything. No one can fool them by telling that this is what and that is what. Again, I just would like to have one another word that to reach a senior position, we must invest in continuous learning. My another suggestion. And step outside of our comfort zone, because always, like as you said, people don't want to get transfer, people don't want to get transfer and promotion. They want to work in that particular area only. Why? Because they don't want to take challenges. So, and they have to come out of their comfort zone. If they sit their comfort zone, they will never grow and make their voice heard at decision making places. At the same time, what I can say that build network and mentors who support our journey, because leadership is never a solo climb. It's a determined step. It cannot happen one day. My dear people, those who are listening to me, you belong to those spaces. If you could break those barriers, so can you. And when you get there, open the door wider for those who come after you. And again, that's how we transform not just our career, but the culture of healthcare leadership itself. I say that if you follow, as I said earlier, I have never been given an application for a promotion or a post or anything after the initial period. Everything came behind me, and people approach me. Then, of course, for a routine purpose, I might have given the application, but otherwise, people approach me, and that is why, because they have seen how you are working, and not limit yourself into that small area. Extend your boundary wherever you can. No, it is not my work, that is not my work. And then nowadays my people say, if I take that work, then they will give me that work every day. So if one day also, if I, no, don't think such of things. Whatever we can do, extend our boundary and help others. So that is what I just would like to talk to my people.
Great, madam. I think this is such an inspiring piece of advice. I'm sure I'm going to edit that and put it into our YouTube channel, and I hope a lot more people can see that. Thank you so much for that advice. And I think we are almost reaching the end. I'm really can go on for a long time. I have several questions which I have not asked you, but I want to end with a slightly larger picture. Healthcare in India, in your experience, I can imagine, even my experience, it has transformed so much. And for you, it has transformed in the last 40 years, has changed dramatically. So what are the things which really excites you, and what are you concerned about?
Yes. Over 4 decades, as you said, Dr. Pari, I have witnessed Indian healthcare evolve from being largely fragmented and a doctor-driven to a system that increasingly values standard, patient safety, and multidisciplinary teamwork. Otherwise, as I said, it was particularly a doctor-driven area. And today, we shift towards evidence-based care, digital health adoption, and patient empowerment. WHO and NABH, WHO in 2023, and then NABH now through the 6th edition. See, there is a growing recognition that patients should be considered as partners in their own care. So, patient for patient safety. At the same time, even my concern is twofold. Number one, I can say that unequal distribution of quality care, because whatever said and done, this quality care is limited to those big cities. And second is the commercialization of the healthcare, which you and I cannot do anything. But only I can say as we grow, we must ensure that the patient safety, affordability, and the compassion remain at the center of attraction. That's what I just say. Or I'm excited about innovation and quality, but I believe that a real test for Indian healthcare will be making the advances ethical, sustainable. That will be there. That's what it come to me.
Okay, ma'am. Thank you, ma'am. And what kind of leader do you think the future of Indian healthcare needs? What skills and what mindsets are very, very important?
Again, what I can say, the healthcare today is complex, technology driven, and with a much different patient expectation than before. So we need leaders who are not just administrators, but visionaries with a strong ethical foundation. These two things are very important. They have to be a visionary, I mean, far-sighted vision, and of course, with the ethical foundation. So the next generation leaders must have at least three main qualities, according to me, that systems thinking, what I can say, ability to see the healthcare in an ecosystem with a quality, safety, financial sustainability, other environmental sustainability, all these things we should be in a position to see rather than we will see it is in silos. Second can be the digital, though I am not that good in digital thing, but the data speaks for everything. You require data at every stage. You have to embrace data. So digital and data fluency is another thing again, which we may have to look into. And most important thing is the people-centered leadership. Means your empathy, emotional intelligence, ability to inspire teams where burnout is high and human touch is irreplaceable. Now, you look into any categories of your staff, really burnout is there due to various reasons. And once it is gone to that level, it is a little difficult to bring it back. Moreover, let me have an advice to my own listeners that you must have the mindset of a stewardship. Stewardship is not a leader who is leading from front, or not who is a supervisor who is just looking from above. It is something working with the people, looking into the people, understanding their problem in their ways. So that way, I request if we nurture leaders with courage, humility, adaptability, I think Indian healthcare system can meet the challenges of our global requirement.
Thank you, ma'am. One last question. When you look back at your career, what is the thing you feel most proud about? And what is the legacy you want to leave?
I will tell you in one word, as I told you, two things which happen in my student life, and that I look, my patient. My patient is helpless. My patient need my help. I am the only person to help them. Like I said, all those beggars and those pregnant ladies, how I treated them. But every day, even that was at the age of 17, now I am in 76. You can imagine what difference it has brought. But now also, I think maybe that blessing is there with me. Because of that, I am a successful family person. I am a successful hospital administrator, and I have all good people as my superior. I have all good people as my subordinates. So that's one thing. Another important thing I just wanted to tell everybody that knowledge have to be the weapon. If you do not have knowledge of what you are doing, anyone can put and push you anywhere like. So knowledge and patient-centered, whatever, whichever post I am, I may be a quality person, but why this post is there? It's only because of the patient. So patient-centric care, patient-centered, patient care, safety of patient, quality care, all this will be my word which I would like to tell. If patient is not there, no hospital will be there, no Gracie will be there, no Dr. Pari will be there, nobody will be there. We want patient. That's what the care to the patient should be our basic motto. That's what I just would like to talk to you.
Thank you. Thank you so much, ma'am. Thank you for your brilliant sharing your career, how it evolved, and also the advice and lessons which we have learned over the last 1 hour has been really exemplary. Thank you so much again. If you have a few minutes time, we could probably take a few audience questions. Do you have the time?
100%. Today I left this time for you.
Oh, thank you. Thank you so much. Stella, are you ready? And other people in the audience, if they want, they can put their questions. A few of them have put the questions in the chat.
Yeah, yes.
Or you could just raise your hands. In your bottom of the screen, there is a raise hand. You raise the hand, then we can unmute you and you can talk. So
Sure.
remember that, madam's time is quite valuable. So don't talk too much. Just ask the question. Yeah, you can start with the questions you already have, Stella.
Yeah, yes, sure. So one question from the Q&A portal. How are AI-based healthcare tools currently impacting the nursing profession, and what potential effects could they have in the future?
First of all, let me apologize. I am not a computer-driven or AI-driven person, but with my little knowledge, what I can say that various AI tools which we have implemented in the hospital have saved the time of the nurses, particularly like this dosy bed or that wearable, what you can say, items of what you wear, all those things immediately giving an information to the nurses that whether the vitals are going upward or downward or those things are there. So that is only because this question, I think Dr. Pari may be a better person to answer, because I am not too much into digital. My people are helping now. Also, my secretary is sitting next to me, because without her help, I may not be able to do anything to that. So, but still better. Today, yes, now we are in the AI era. We are in the digital era. We have to embrace the digital platform. We have to embrace AI so that our work will become smooth. But whatever the hand of a nurse can do, that nothing can do.
Agree, madam. I think I don't have anything to add. You said everything. I think there's someone who raised the hand. Is it still there? I can't. Yeah. Indira Rani, you can actually, unmute yourself and ask the question.
Namaskar, ma'am. I'm Captain Indira Rani, Director Nursing, 𝐬𝐲𝐬𝐲 Medicity in Ghaziabad. I would like to ask you one question. The journey is quite inspiring. The concepts you have put up and the advice you are given for people like us is commendable. So what I would like to see, ma'am, as you said, that AI reaching in the bedside and more of mechanical monitoring of the patient. I have seen as a nurse, the human touch is vanishing slowly. It is almost the nurses or doctors hardly they touch the patient. So that's very important when you touch a patient and take care of a patient. How do we tackle this, ma'am? The vanishing of human touch.
But nothing can replace human touch, which I have already said. Whether the doctor or a nurse or anyone, nothing can replace human touch, because that human touch, because machine cannot touch like a human. That human touch have to be there. See, that's why we will have this nurse-patient ratio or doctor-patient ratio. Why we are maintaining it is only because every doctor have to communicate with the patient. Every doctor have to examine, as you said, now clinicians I am talking. Every doctor have to examine how much ever your system, how much ever your AI will tell you the real exact fact. That's why telemedicine also we say that there are limitations, because we are not examining the patient. So examining the patient is very important. I think that has to bring back, and that cannot be vanished. That's very important. Every healthcare organization, rather leaders, also have to give importance to that touch.
I would want to add one thing here, madam. I agree with you, Captain Indrarani, that
Yes, ma'am.
it is difficult now with the technology. The one classic example is the pulse oximeter. So before, we had the opportunity to go and touch the pulse of the patient first. That's the first thing, you used to do when you go to the bed of the patient. Now you go like this, right? So you need to make a very conscious effort to bring back the touch. That's what I do in my practice. I actually go to the bedside, and no, otherwise there's no need for me to touch, except probably
Even Dr. Pari, even my nurses also, they go to the bedside.
So you need to, have that, even though you may put the pulse oximeter on the patient and you may not actually count the pulse, I still hold the hand of the patient as a gesture. So I think this probably, we were teaching our clinicians how to take the pulse, how to, measure respiration and all that. Now we maybe have to teach them how to do gestures to make sure the patient touch is still there, because technology will do all the measurement. But we are actually freed ourselves to do more of human interactions and touch. So it's a conscious thing we have to do. I fully agree with that the challenge is there, as you have told, but we need to make a conscious, effort towards that.
Yes, sir. Thank you, ma'am, and thank you, sir, for the enlightening us. Namaskar, sir.
Thank you. Thank you so much for your very interesting question. I think there's one more question.
Yes. Two more questions are there, sir.
Yeah.
Ma'am, it's like one question is like how we can handle our nurses when they commit errors which affects the patient care.
Error is human. This is a common thing, yes or no? So nurse may do some mistakes, but you should not hide it. Any mistake have been done, that has to be like what we do in our today's accreditation world. What we do, an incident have to be raised, and that incident raising is not to punish anyone. That's another thing. It is not to punish anyone. It is just to find out what went wrong. Who did wrong? We don't want to know. We want to know what went wrong. So if that what went wrong you come to know, that you will see that such mistakes are not repeated in the future, so that appropriate corrective and the preventive measures have been taken. So especially, we cannot consider all our nurses are expert. There are some novice nurses are there, and education with these nurses have from different colleges, and that education is being different. So when they come to an accredited hospital, primary responsibility of the nursing leader over here is that to give an orientation training to all the newcomers, not the induction training which is given by the HR department, but an orientation of your nursing department, what is being expected, what it has to be there, how it should be performed, and we have various other protocol procedures. All these things has to be explained to her, and regular observation of although this particular person. And if it is a novice person, what you have to do, you have to keep her or him under some mentor. So let this mentor also take responsibility, and then making changes in this particular person. That way, gradually, if you just punish them and leave them, many people leave you, and then you will end up in recruiting and exiting. Though not that way. We want them to be with us. We want them to continue with us. So train them, counsel them. That's very important. What I can say, counsel them and understand their background, and then treat them. I don't think there will be any problem at all.
And the previous question.
I think we'll keep this as the last question, I think. So, no?
Yes, sir. So last question is from Mr. Xavier Dixon. Like my question is like, he has asked like, is it our nurses are ready for the future? And the current healthcare industry is facing a huge staff shortage. How the future patient care will be challenging in future? So what's your plan to drill the nurses to meet the future need?
I didn't get nurses shortage is there. That's what you mean to say?
Yes, ma'am. Yes.
Okay.
So
see,
what we are going to do?
Nurses shortage is not all an Indian problem. It's a global problem. Nurses shortage is there. Why the shortage is there? I can tell you. Reason, there are many opportunity outside our country. I mean, shortage in our country. There are many opportunity outside country with much lucrative facilities. But few nurses, few means I can say maybe a good number of nurses, they leave the job and sit at home, maybe because of their family problem. Somebody is sick at home, or children are sick, or children's education, or children are small, and they cannot cope up with the 3-shift duties and all those things. So I have a suggestion. and even what I have told, even my own organization also, we can have a list of all those those who have gone abroad, they will not come back. Let them go, and we may not be able to give them that much even salary or facilities over here. They will not come back. But with our own people, those who are just sitting at home without any job, but they want to work because of our stringent protocol procedure, they cannot come. Have a list of those people. And whenever you have a shortage, maybe a shift shortage, or maybe a short-term shortage, or maybe a long-term shortage. A short-term, and when I say some people are sick and then they are some chicken pox. So some 10, 15 people are having chicken pox, and some 10, 15 people are on leave for 10, 15 days. A long-term leave means like you can say some 20 young nurses gone for maternity leave. So that 6 months there is absent. So such thing, I think we can manage with these type of people if you can have the pool of this thing. So that shortage, temporary shortage can be, I know a few hospitals, they follow this, especially in Bombay, they follow this, and their shortage is being covered. Otherwise, what happened? This shortage will continue, and shortage will continue, and the burden increase, and nurses again will go into burnout. Again, they will leave the job and go. Further shortage will come. So that will come better.
Thank you so much, sir. We are ending up with the Q&A.
Yeah, I think so. No, it's almost.
Yeah. So no, we have 2 more questions. So
Okay, you want?
yeah, ma'am, is it okay? Like, because
Oh, no problem, beta, no problem.
yes. So that was like how to handle nurse who refuses nursing care to the patients.
Oh,
So I just don't want to
nurse
leave
who
the
refuse
question.
nursing care should not come for nursing. One straight answer. Okay, if she
Yes.
refuse, then why she came for nursing? There is no other answer for that.
Yes, absolutely. And one last question, ma'am. Legal compliance and nursing leadership role. So can you just give us a quick brief about that?
But particularly legal compliance is not the nursing responsibility, okay? Legal compliance of a hospital is mainly the CEO's responsibility, and then under him or her, there will be 1 or 2 person who will be looking into the legal aspect. Whereas some nursing related thing they may have to help, otherwise never legal come under the nursing responsibility. Let me tell you very frankly, it is a top management, and a legal cell will be there who will be regularly looking into that which is expiring now and what is to be reviewed or renewed. All those things will be seen by. And if a nurse have taken responsibility on her head, it will be better. It will be an additional knowledge for her. That only I can say. Otherwise, it is not her responsibility better.
Sure. So we have done with all the questions, ma'am. Thank you so much for your, we had a lot of insights, and you have given us a thoughtful answers for what all Dr. Pari have asked, and your advice towards continuous learning, and you have given a real example. You have set example, and also you have given us a way how to become a good leader in the nursing leadership. So hope we all will follow that to become a good leader in the nursing field. And thank you so much, ma'am. So it was like it was not like a podcast for me, Dr. Pari. It was like watching or listening to a nursing success story. So it was like that. So thank you so much for sharing your time and sharing your valuable points to all of us. Thank you so much, ma'am.
Thank you so much to each one. Dr. Pari, special thanks for inviting me.
Thank you so much, man. I'm really happy that this happened, and there's so many people who benefited from your experience and advice. Thank you so much. Thank you.
Thank you.
So you both can take a leave, sir and ma'am. So we'll be here continuing for our webinar participants. So until they complete the feedback form, the Zoom room will be open here. So thank you so much, sir.
Yeah, thank you. Thank you so much. Bye.
So dear all participants, this is our October month webinar program details. So the first week will be on this crash card, managing the crash card, a simple weekly checklist. And, second week will be on acuity-based nursing allocation, organizing care for safer and smarter workflows. So on behalf of that, we are having that contest which I announced in the beginning of the webinar. And third week, the topic will be on one missed dose, one wrong entry, lessons from medication reconciliation errors. And the fourth week again, like today we'll be having a special guest on that day. So it's a special edition. Stay tuned. So this is our online CNE program. So if anyone the people who have joined from the organization and from the management side, so you can if you're really interested to log in with our online CNE program, you can contact our Jayanti, who is our admin manager. So let me get back to it. So here you have QR code. So this is the QR code to join our WhatsApp community. So all the participants, I request who all have not been in our WhatsApp group, you can scan this QR code and you can log into our WhatsApp group, where you will get the regular updates. And after this session, so we'll be posting that contest details again in our NPower group, and also we'll share the registration form link in NPower group for your easy access. So I request all the participants who have filled the feedback form can leave the Zoom room, so that we'll have an understanding who are yet to complete the form. Thank you so much.
Better, एक minute. I'm doing something. लो
मैम हम हॉस्टल के लिए बात करें
हाँ बैठो
जी
बैठो इधर बैठो
मैं ब्लड क्रॉस की ना मजाक
आप लोग कहाँ हो? आप ओरिएंटेशन में हो
मेरी जर्नी है भी इंडक्शन कंप्रेशन चल रहा है मैं अभी तो लाट की
लंच बॉक्स कौन लेकर आएगा बेटा
मैम कोई फिक्स नहीं है जो लेके आने होता है मैम वो लेकर आते हैं लेकिन अगर मान लीजिए
Indrani
आपको
madam, can you please mute your mic? I'm sorry. Thank you so much, ma'am.